Hello, everybody. My name is Idiomi Enabong. This is my integrative review presentation for NSC 890. The focus of my presentation will be on depression and anxiety amongst older adults. Anxiety is defined as an emotion characterized by feeling of tension, worried thoughts, and physical changes such as increased blood pressure. People with anxiety disorder usually have recurrent thoughts or concerns, and they might avoid certain situations out of worry. What is depression? A depressive disorder is an illness that involves the body, the mood, and thoughts. It interferes with daily life, normal functioning, and can cause pain for both the people with the disorder and those who care about him or her. A depressive disorder is not the same as a passing blue mood. Healthy People 2020 explained that mental illness, which includes anxiety and depression, is the most common cause of disability. Mental health and physical health are closely connected. Mental health plays a major role in ability to maintain good physical health. Mental illness such as depression and anxiety affects people's ability to participate in health-promoting behaviors. In turn, problems with physical health such as chronic diseases can have a serious impact on mental health and decrease a person's ability to participate in treatment and recovery. Depression is projected by World Health Organization to be the second leading cause of incapacitating disease by 2020. Depression is the leading cause of disability worldwide and is a major contributor to the overall global burden of disease. Close to 10% of the population is affected, and mental illness, including depression and anxiety, accounts for about 30% of the global non-fatal disease burden. Between the years of 1990 and 2013, the number of people affected from depression and anxiety increased by nearly 50%. This being from about 416 million people affected in 1990 to about 615 million affected in 2013. World Health Organization has listed cognitive behavioral therapy as an effective treatment for depression and anxiety. Cognitive behavioral therapy is defined as a goal-oriented physiotherapy treatment that uses a practical approach to problem solving. The outcome of this therapy is to change patterns of behavior or thinking associated with difficulties, therefore changing the way the person feels. I pulled up two studies. One study was a randomized controlled trial carried out by Rithrick and Rate. This was carried out in 2013. Participants had to be at least 60 years old with both anxiety and depression. They were randomly allocated to either a control group or an intervention group. Those in the intervention group received CBT, cognitive behavioral therapy, once a week, lasting about 2 hours for over a 12-week period. On the other hand, those in the control group continued with their usual treatment. After about 3 months, the intervention group showed a great reduction on symptoms of anxiety and depression than the control group. The second study was also a randomized controlled trial, and the participants were required to be at least 60 years old and had to be diagnosed with just depression. 40 participants were assigned to the control group and 41 were assigned to the intervention group. Intervention group received cognitive behavioral therapy once a week for lasting about 1.5 hours for a period of 12 weeks. This study used a patient health questionnaire, which is also known as PHQ-9, to measure intervention effectiveness. Effectiveness was defined as a decrease of at least 5 points on this scale. After about 3 months, 56% of the participants, which is about 23 participants, displayed a decrease that was greater than or equal to 5 points on the PHQ-9 scale. compared to only about 30% in the control group, which is equivalent to about 12 participants. Given the negative consequences of anxiety and depression in older adults, interventions such as cognitive behavioral therapy may help reduce the risk of negative outcomes and produce a lasting benefit for older individuals. This can also lead to increased quality of life, as well as increased functioning for patients diagnosed with anxiety or depression. Anxiety and depression. Cognitive behavioral therapy can be implemented in an outpatient clinic as well as in a community setting. Interventions can also be incorporated to clinical practice through the cultivating of a spirit of inquiry. Getting clinicians to see that there's a need for change and there is something out there, such as cognitive behavioral therapy, that can result in a better outcome for patients, can be a way to initiate spirit of inquiry. Psychiatric mental health nurse practitioners can back up their claims with supporting articles, such as the two that was presented. Thank you for your time, and have a great day.